Nova Scotia will keep its mask mandate in schools until at least after the May long weekend. The province announced that decision yesterday. The mandate was supposed to end in the middle of this month, but because COVID cases are rising, masks in class, the thinking is, could help keep kids safe and keep the schools open.
We understand that there are a lot of mixed emotions about this, and there are, really it's about balancing interests. There are benefits to coming into school without masks on. You get to see the faces of your friends, the faces of your teachers. It helps students with their social and language development. So we know that we have to really weigh those interests in deciding whether to keep masks on or not. This extension till the May long weekend gives us another opportunity to weigh those and balance those considerations.
That's Nova Scotia's education minister there. She spoke to CBC News' Becky Druin. So students, staff, volunteers, visitors, they must wear masks during school hours and on buses. The province has lifted its mask mandate by and large for public spaces, still required, though, in healthcare facilities, in jails, and in courts. Masks, one of the things I'm looking forward to speaking about with Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang, back with us this morning. Welcome back to our program, Dr. Strang.
Thanks. Good morning, Heather.
Good morning. Is Nova Scotia into a sixth wave right now?
Yeah, absolutely. We look at our case numbers over the last few weeks and the trajectory upward. We are certainly well into the sixth wave, like other parts of the country.
In fact, the cases in Nova Scotia are higher than ever, and we don't even have the accurate numbers. So the numbers are higher when it comes to cases as well, in a province that really had been a bit of a standout earlier in the pandemic. What happened to have such a drastic turn so quickly?
Well, I think it's like everywhere else where, as we're opening up, removing restrictions and mandates at the time when we have first the Omicron wave, and now BA.2 is becoming more of a part of our picture, and that's even more infectious than Omicron. So we have two highly infectious variants, very easily spread between people and very hard to control. On top of that, we know our relative success in the last 2 years in Nova Scotia, other Atlantic provinces. We have more people remain vulnerable to infection than perhaps in other parts of the country. But I think we need we're certainly in public health, we're focused much more on hospitalizations and what is the level of severe illness that we're seeing, and what we know. We have lots and lots of cases, and yes, our hospitals and long-term care facilities are under pressure, but actually the risk of getting severe disease is very low, and that is really attributed to the strong protective effect of our high levels of vaccination.
That's interesting, in some ways, a victim of Nova Scotia's success and what you're seeing right now. But back to the case numbers for a moment. Yes, hospitalizations are important. Deaths are up in the country, in the province as well. And yet, there are no returns to these widespread restrictions, Dr. Strang. And Nova Scotia is not the only province making that decision. It's pretty much the norm in the country. Explain why that is. Why is the attitude different this time?
So I think, certainly in public health, we look at our goal through the pandemic has been to minimize overall harms, and knowing that that we have to control the spread of COVID, but all the strict measures we used over the last 2 years have had their own set of significant financial, economic impacts on people's mental health, not insignificant at all. So given the protective effect of the vaccine against severe disease, especially, then it's very hard to justify that we have to continue with those tight restrictive measures, like restricting gathering numbers, closing things down, because of their own set of harms. So this is what all those restrictive measures were really necessary when we didn't know as much about the virus, when we didn't have the vaccination coverage that we have now.
About finding that balance then. Do you foresee circumstances changing to a degree that you would have to rethink that and indeed go back to capacity limits and other forms of restriction?
I really only see that happening if we get a change and a new variant that isn't covered at all, even against severe disease, by the current vaccine. So it would almost be like starting the pandemic all over again. And that is a remote possibility. So this much more likely is moving forward is continuing to try to control COVID by focusing much more on what people can do to keep each other safe, but not having the mandates in place. Certainly, I think masking is a good example. Public health, certainly in Nova Scotia, and I know my colleagues across the country, we still strongly recommend people wear masks, whether they're mandated or not. We also have to understand that it is elected governments which makes the decisions on mandates and restrictions, not public health that does that.
So one of the things that people can do, and you've already pointed to vaccination, I know Nova Scotia is looking at expanding availability and access to fourth doses, so second boosters in the province. What is your view right now? Are you convinced by the research to this point that there's a benefit of fourth doses for the general population yet?
Well, we really follow the advice of the National Expert Group on Vaccination, NACI. They've looked at the evidence, and their recommendation is that people 70 and above, as well as residents of long-term care facilities, are the ones who at greatest risk of having now waning immunity from their previous vaccinations, and also at highest risk of severe disease, and therefore they need another booster dose. And we'll be rolling that out in Nova Scotia starting next week. But clearly, NACI's looked at the evidence, and they're not saying that younger age groups need another booster at this time.
I have time for just one more question in this conversation, but I hope to have you back on the program. Coming up this weekend, it is Easter, it is Passover, it is Ramadan. Families and friends are gathering to celebrate and probably had hoped that this season would be different from the two previous. But there is real concern with the infection that's out there. What's your best guidance?
So I think absolutely these are very important times for various faith groups, communities to get together. But we still have to get together in a safe manner, knowing that there is a lot of virus across the country. We're in the sixth wave. So I've been saying to Nova Scotians all week, still get together, but get together in those small groups that are hopefully they're consistent in the numbers and the people that are getting together. If you are getting together, certainly people, if they're got new onset of cold or flu-like symptoms, absolutely don't go to the gathering that you were expected to go to. Also be careful about who you get together with. So people who are at older, starts at about age 65 and above, people with underlying health conditions, people perhaps for one reason or another who may not have been able to get vaccinated. Those people are all at much greater risk for severe disease. So how we get together with them, we need to be really careful. And one of the things we're promoting in Nova Scotia, and most provinces have access to rapid tests, is if you are getting together with people at higher risk, do a rapid test before you go to that gathering. And also use masks. It's still really important. Masks can make a big difference if you're getting together, especially in indoor environments where you continue to mask as much as possible, knowing that there's eating and drinking that goes on. All those have kept us safe for 2 years. It's really important we continue to follow those personal measures to get us through this sixth wave.
Dr. Strang, as always, thank you very much for the time.
Thanks for the opportunity.